Hello, and thank you for joining us today. I'm Sheila Casey, Chair of Blue Star Family's Board of Directors and the Chief Operating Officer of The Hill. As a military spouse, I know military families are extremely proud to serve our country, and they work hard to stay strong while facing the added burdens of military life. I also know that what keeps military families strong is support from us, their community neighbors, and organizations like Blue Star Families. To bridge the gap between military families and civilian communities, our heroes and their families turn to Blue Star Families to be the liaison, advocate, and catalyst. Blue Star Families does this by partnering with civilian neighbors, both individuals and organizations, to create stronger communities of support for military families. As we enter these final days of March, it is hard to believe that our entire way of life has been upended over the past year. We are starting to see the light at the end of the tunnel, but we are only beginning to understand the effects of COVID-19 pandemic on our country and our military families. Because of Blue Star Family's annual Military Family Lifestyle Survey, we not only have great insight on the issues facing our military families, we also have a unique view on just how difficult COVID-19 has been for them. This year, we will focus on 4 important topics. 1, the impossible choice, housing, schools, and financial stability. 2, impact on women, female service members, and military spouses. 3, the lived experience of diverse families and implications for command. And 4, military children's mental health. And of course, how the pandemic exacerbated these already tenuous situations. Mindful of Zoom fatigue, we've engineered this year's release into a series of smaller virtual events focused on different topic areas. During today's event, you will hear personal stories directly from military families and engage in a dynamic discussion focused on a topic that directly impacts our military-connected families. Following the main panel, we will share additional data and insight and engage in more discussion during a data breakout session, which all are welcome to join. Again, thank you for joining us today and investing your time in the well-being of our nation's military families. Our nation is strongest when our service members and their families are thriving. Our military's readiness depends on strong military families, and they're counting on Blue Star Families and so many of the partners attending today to be the liaison that bridges the gap and keeps the mission ready.
I don't come from a military family, but I did fall in love with a member of the military and married him. Shortly after I was married, within a year, I found myself pregnant and then giving birth to a child who had a life-threatening hole in her heart. As I was looking for doctors and arranging her imminent surgery, my husband was coordinating our move to Okinawa. When she was 2 months, she had open heart surgery in Boston. By the time she was 3 months, my husband had already moved to Japan. So there I was, a new mother with a sick infant in a new country, leaving behind family and friends. I lost my job, my career. It was a lot. To civilians, this story may sound shocking, but to military folks, it's familiar. The fact is, all military families have stories to tell. Our stories make us stronger, resilient, but truthfully, many military spouses suffer in silence. 2020, in particular, was a challenging year. We pivoted our programming almost immediately to ensure military families had access to resources, virtual activities for their families, access to timely, useful information about COVID-19, and more.
The Military Family Lifestyle Survey has been tracking issues that military families experience for over a decade now. Some of those issues come up every year. They're persistent: spouse employment, children's education, time away from family. All of those things have been intensified by COVID-19 and this global pandemic that we're in. So Blue Star Families takes those impacts that military families are experiencing and shares them with decision makers so that they can continue to best support their military families.
This year's been difficult for everyone, but military families have been particularly hard hit, which is going to be demonstrated in the findings you're about to see. The pandemic has hit military families' ability to access resources, their ability to achieve financial stability, and it's caused families to make difficult choices about life-changing issues, such as whether they should live apart or how they can protect their family and educate their children in this new environment.
2020 was a very challenging year for everyone, but in particular for military families. Well, some of the things that we saw from the survey this year are service members' experiences of racial and gender discrimination during their military service. We saw spouse employment concerns intensify for families who are trying to virtual school or homeschool their children because of the shifts in children's education. And we saw tremendous shifts for military children's mental health and the impacts of COVID-19 and school closures on military children.
I like to call our survey the People Survey, and this year for the first time, the people get to be part of the release of it, because due to COVID, we have this virtual event. And that means our members across the country are able to tune in, hear the results, and participate in the discussions afterwards. I think that's really exciting.
Military family resilience is absolutely tied to how well military families feel connected to the communities in which they live. Our hope is that, working together, we can better design and implement effective programs, solve problems, and minimize gaps when it comes to serving the unique needs of our military families.
I am grateful for each military and veteran family member who takes the survey. None of this work is possible without their voices. Their voices are what drives this change.
Our families are resilient, and they're the heroes in this story. Blue Star Families is here to help, to provide solutions, support, and to welcome them through our programming.
Well, hello again. For those who are joining us for the first time, thank you for coming. For those who are with us for this fourth and final panel, we're very excited you've stuck with us and you deserve a gold star. Blue Star Families Annual Survey, we like to look at topics that haven't always been covered in the past. And the mental health of military children is certainly one of them. The country's turned its attention to veteran mental health. That's very important. But those of us who are members of Blue Star Families, military families, wonder what has it been like to be raised in a post 9/11 military family. Some of these kids are adults now. Some are still very young. There's been very little research about what the experience has been and what the impact has been on mental health. Blue Star Families has started doing more work in this area. We feel there is much more work to be done. We have a fantastic panel and some very provocative comments from leadership. So we look forward to you joining us on this journey. First, though, before we go to our panel, I'm honored to welcome a dear friend and Blue Star Family supporter, Congressman Sanford Bishop. Along with his colleague, Kathy McMorris Rogers, Congressman Bishop has hosted several survey launch events on Capitol Hill, and he has used the results to develop legislation to better support military families. As co-chair of the Military Family Caucus, he's so aware of the challenges facing military families. Congressman Bishop, thank you so much for joining us today.
Hello. It's always an honor for me to speak in behalf of the Congressional Military Family Caucus for the military families of America and all of the individuals and groups that support them. The sacrifices that all of you make to serve our nation are deeply important and deserve more attention. When my colleague, Representative Kathy McMorris Rogers, and I founded the Congressional Military Family Caucus, that's exactly what we wanted to do: bring more attention to the unique struggles you face and to work to solve them. Blue Star Families and the Military Family Lifestyle Survey are a huge piece of that puzzle. This annual survey is the largest one conducted, and it's vital to helping inform policymakers about the current issues faced by our military families. The results of this year's survey have shown some of the top concerns for military families are underemployment and unemployment for military spouses, access to pay and benefits such as healthcare, time away from loved ones, the effects of the military life on children, all of which have been intensified by the COVID-19 pandemic. The pandemic has created dual crises, both health and economic, and military families have felt them both. The panel today will talk about the impact military life and the pandemic have had on our most vulnerable family members, our children. One aspect of these top concerns, particularly during this pandemic, is rising food insecurity in military-connected communities. The data from this survey show that 14% of enlisted active duty family respondents reported low or very low food security, the highest percentage being among junior enlisted families. It is also highest in families where spouses are unemployed but need and want to work, the all too common problem for military spouses who have trouble maintaining employment when moving so often. Without food on the table, it's difficult for anyone to function, let alone children who grow so quickly and face the many difficulties of having a parent in the military, and now have the added stress of a pandemic changing life as we know it. Inadequate access to sufficient, safe, and nutritious food that meets individual dietary needs is concurrently associated with children's psychological difficulties. It is sadly not surprising that children would have trouble with their mental health when faced with these obstacles. In my role as chairman of the Agriculture Appropriations Subcommittee, I'm working diligently with my colleagues to address this tragic problem. It's a fundamental government function to feed the military. Those who are sacrificing the most for our great country should not have to face problems putting food on the table. Feeding yourself is the first step in self-care. Without it, we cannot tackle the more complicated aspects of mental health. I want to thank Blue Star families, all of the survey participants, and the panelists here with us today for helping to educate us all on the mental health of children in military families. Your honesty and your expertise are valued and much appreciated. I believe the information discussed here today will be pivotal for understanding how we can better support the children in military families. While all of us have probably experienced emotional distress during this anything but normal time, we will be learning for a long time how we can help children who are growing and developing through it all. Again, thank you. Thank you, Blue Star families. Thank you to our military families. God bless you and God keep you.
Thank you, Congressman Bishop. Thank you for helping us take the findings from this survey and bring them to Capitol Hill. Legislators are a very important audience for us with the work that we do, and we're really grateful to have the help of the caucus and our many partners on the Hill. Now, it's my real pleasure to introduce Ann Milley. Mrs. Milley is the wife of General Mark Milley, the chairman of the Joint Chiefs of Staff, as well as a nurse with over 30 years experience. She's a military spouse of 35 years and a mother of 2. Mrs. Milley has been rolling up her sleeves and coming out to help military families. She's been right there alongside us whenever Blue Star Families asks for her help. I know she's been a real advocate for many of the other support organizations and to the military families throughout the country as she goes on her travels. I appreciate, Ann, your honesty and your openness so much. I'm very excited to present the message that you've prepared for us today.
Ladies and gentlemen, it is an honor to be a part of today's summit. I would like to thank Blue Star Families for their notable efforts to organize events like this to promote the health and wellness of our military families. I'd also like to thank the members of the panel who will address such an important topic, the mental health of our military children. About a year ago, Kathy and I had a conversation about military children and mental health, a topic that is near and dear to my heart, as I've witnessed the effects on so many military children and their families. I'm thankful for the opportunity to introduce such a relevant and needed discussion. Talking about mental health is important to me for many reasons. For more than 35 years, Mark and I have had the opportunity to travel to bases around the world. When I speak with military spouses, they bring up mental health as one of their top concerns. As we all know, however, this is not just a military challenge. It is a national challenge. People are discussing the effects of mental health more now than ever before, especially due to the current pandemic. We need to continue this momentum and growth by continuing to talk about it. Today's panelists will discuss the mental health of military children, as well as the effects COVID-19 has had on our military families. Data collected by Blue Star families highlight the strain COVID-19 has placed on our children. Abrupt educational changes and a shift to virtual schooling, telework, and telemedicine have rearranged the rhythm of our lives. These universal issues are compounded for military children with their unique set of challenges, frequent moves, school changes, making new friends in unfamiliar environments, and the stress of having a parent deployed away from home. As a military spouse for over 35 years, and as a mother of 2 adult children, I'm very familiar with these challenges and know they have a real and lasting impact. As you can see from the wall hanging next to me, that goes a lot higher and a lot lower than you can see right now. Our family has lived in 9 different states. We've moved 14 times, including twice overseas, and our children have had to attend 9 different schools before heading off to college. Through these experiences, they have gained valuable skills and lifelong friends, but our military lifestyle certainly wasn't without its hardships. I'm recognizing these hardships more fully as I speak with military families with children at home, to my adult children, and to their peers who grew up in the military. I'm learning now what some of the sacrifices look like from their point of view. September 11th, 2001 changed so many lives in ways we could never have imagined 20 years ago. That's a large part of what I want to share with you today as we lead into the discussion. Being a part of the military family community for as long as we have means we've seen a lot. We saw the start of the War on Terror and the many, many combat deployments marked by catastrophic injuries or death. When Mark left for combat, it was different than other deployments or training missions that the kids were used to. The media coverage was constant, and there were so many unknowns, especially for young people trying to make sense of it all. I remember our children asked Mark, "Why do you have to go to war?" And Mark explained the best he could to a little girl of 12 and a boy of 9 years old. I remember him saying, "Imagine we all lived on a farm. Now imagine our neighbor's farm is on fire. We've got to help. We've all got to do our part to help and make sure that fire doesn't spread." Sometimes our children carry burdens in ways that they simply aren't able to articulate at such a young age. There are kids who feel that if they're not perfect or they don't make straight A's, that's why mom or dad have to leave. They strive to be a perfect person, so then maybe mom or dad won't have to go. I remember another discussion that I can see now was our children's way of getting confirmation that Mark would do everything he could to come back home. They just needed reassurance that their dad was going to come home. And of course, adults and children understand things differently. It's so common to hear a passing, "You're the man of the house now," as parents head out on deployment. You see it in movies, you read it in books. But when you're young, that's actually a pretty heavy ask. When you're young, you can't necessarily articulate, "Wow, okay, they just put me in charge, but I'm just a kid." As an adult, you don't hear it that way, and you don't think about the weight a young person might feel carrying such a grown-up responsibility. There are a few things that kids can't always express when they're younger. As parents, we all do our best. We do the best we can for our kids. Like all moms, I was trying to protect them. I kept the news off all the time. I only watched it when they went to bed. When we had a soldier who was killed or wounded, which is always a tragic event, I would try to keep it as quiet as I could. Talking to my adult kids now, there were emotional moments that brought me to tears because I just had no idea that they were trying to protect me. Despite all my efforts, my kids knew, but I didn't know they knew. I found out that those times when I'd lower my voice after receiving a phone call or subtly taking an extra trip to the commissary to prepare meals for a grieving family, they would know to meet with their kids in the neighborhood, their own backyard FRG, I suppose, and together they would figure out whose soldier was killed or family member was wounded and be ready to help each other. These children were just trying to figure it all out for themselves. They didn't want to see their parents sad. Another reminder that our kids are not oblivious to what is happening around them. Through all of this, mental health was rarely, if ever, discussed. I personally didn't see this change until suicide rates rose and the military began post-deployment assessments for soldiers at the 3 and 6 month mark. Then I started to see the stigma surrounding these necessary mental health conversations for service members, their spouses, and their families slowly shift to be part of the overall health and wellness. Even without armed conflict, there is a lot for a military kid to deal with. There is the perpetual move cycle, which is so important to military readiness. So often, a service member returns from deployment and it's time to start to pack and head out to the next duty station. During these times of flux, not only do service members and spouses lose their support systems, military children do too. They move away from their backyard FRGs and head for a new start at a new school. It's here where I've witnessed children falling through the cracks as they cope with uncertainty. And for some of our military families, the challenges faced can be greater than others. For our Gold Star families and our Wounded Warriors families, there can be lifelong trauma. Fortunately today, we have open discussions about mental health, like this event. And as we work to bridge remaining gaps in care and communication, there are several resources for our families, like Military OneSource and Military Family Life Counselors, which are free of cost for our service members and their loved ones. I know it's easy to say, go see your provider or talk to the MFLC. Despite some available and well-funded resources, we still have a long way to go. Our military families need to know that open conversations are not just acceptable, but they're encouraged, and that the resources will be there beyond a shadow of a doubt when and where they need them. For many, many people, especially in our military community, it takes a lot to reach out and ask for help. Sensing that help is not there when they finally come to the point of reaching out that first time stands in the way of ever trying again. One care guide put it particularly well, stating, "The true test of whether there is adequate capacity to meet the needs of the community is by assessing whether individuals are able to access needed services in a timely manner." This is where I believe we are headed. We need to understand the issues, understand the needs, understand the gaps, and understand the resources so we can work together as a community to ensure support is available every time. We ask a lot of our military children, and we need to ensure they have the resources to have a thriving childhood that leads into a successful adulthood. We need to continue to work together to take care of these families beyond their time in service. A final thought I want to share is a simple yet sometimes overlooked one. Like our service members, military spouses often volunteer to participate in military life. Our military children have not made this choice. They are often born into the military lifestyle and are along for the ride. Military lifestyles shape our children for the better in so many ways, from living abroad and immersing themselves in new cultures to developing life skills that help them to be resilient and adaptable when faced with change. The experience that builds such coveted skills can also bring stress to military children, and we owe them the very best in education, in healthcare, and psychological support to fortify them for the unique opportunities and challenges the military lifestyle can present. Over the years, it becomes more clear to me the basic need, dare I say requirement, to show kindness and patience towards others. We all have challenges, and we never know what challenges other people may be facing. Mark has repeatedly said that the joint force is only as strong as the service members and the families who stand shoulder to shoulder with them. And I could not agree more. We all need to keep sharing about the importance of nurturing mental health and advocating for the resources our military families need. It is an honor of a lifetime for Mark and I to continue our journey in service of our country. We are inspired every day by the service members and the families who sacrifice so much for our nation, and especially our beloved military children.
Wow, Holly Ann, it's really an amazing message. And I'm so grateful to you and hope that you can be a role model for all of us, a role model in your compassion and in your honesty. And I think that is the way forward. So thank you. I think we all know that the COVID-19 pandemic has been challenging for everyone's mental health. We've been talking about the pervasive challenges and the unexplored challenges that children have faced. But with the pandemic, educational shifts that come with PCS, frequent time away from service member parent, access to mental health care and continuity, all of this has been a normal challenge for families. The pandemic has exacerbated an already really challenging situation. So I'd like you to meet August, a military spouse and a mother of two. She faced the challenge of homeschooling her children when the school shut down and facing the challenge of the new normal. On top of that, she needed to meet her son's individual education plan. So now it's time for August to tell you her story.
My name is August Manzano, and I am a stay-at-home mom and maybe ombudsman. The last 12 months with COVID-19 and the pandemic it's been extremely difficult for us. One of the hardest things that I've ever had to do as a parent is watch my child tell me that he'd rather be dead than go to school on the computer again. It tore me apart to have my 6-year-old be so afraid to go to school online. The fact that 51% of active duty with kids think that their kids can't get access to mental health care is astonishing. It's heartbreaking, and it's so true. We haven't had any access to any services for our kids, even speech therapy. We've been on a 2-year wait list to get both kids into speech therapy, and in 10 months we'll be moving, and then wherever we end up, it could be another year wait. So for us, it's really frustrating because we watch our kids struggle and we can't help them, and it's heartbreaking as parents. When I had someone reach out from Blue Star Families, it's an amazing feeling to know that we have support, because everybody needs support. And it kind of feels like a friend is on the other end of the line saying, we got you, we hear you, we're here for you.
Hi, I'm Brian Tucker. I'm Vice President of Corporate Communications at CSX and very proud board member of Blue Star Families. In 2018, CSX launched our Pride in Service initiative, which is really our company's initiative to provide support and resources to our nation's service members and their families. And as part of this initiative, we've been a proud partner of Blue Star Families, and in particular, the Military Family Lifestyle Survey. So important to have access to these insights, and it really gives us a better understanding of what type of resources and support is needed by our military families. And we know from many years of data from the Military Family Lifestyle Survey that children's mental health concerns and access to care are top stressors for military families. And the most recent Military Families Lifestyle Survey found that 6% of active duty respondents reported that their child expressed suicidal ideation in the past year. And 52% of active duty military family respondents said that their children's mental health worsened due to the COVID-19 pandemic. And 51% of active duty family respondents reported that they can access high quality mental health care for their children. And this is a great setup for the upcoming panel. It's my honor to introduce Dr. Patricia Lester to moderate the panel, Military Children's Mental Health. Dr. Lester is a Nathanson Family Professor of Psychiatry, Director of the Division of Population Behavioral Health, and Director of the Nathanson Family Resilience Center at UCLA. Her research and clinical work have been dedicated to the development and evaluation and implementation of family-centered prevention and treatment for families facing impact of military deployment, traumatic events, and parental illness. Dr. Lester, I'll turn it over to you to begin this engaging and robust discussion.
Thank you, Brian. And thank you to Kathy and Blue Star Families for putting this together. Someone who's spent the last 2 decades really dedicated to the well-being and mental health of military kids and their families. I'm really honored to be here and to hear from our panelists and to engage in this really serious discussion. So without further ado, I'm going to go around and briefly introduce our panelists and hope that they'll share a little bit more about their own personal experience as we get to the questions in our conversation. First, we have Dr. Corinne Elmore, a clinical health psychologist and chair of the APA Committee on Children, Youth, and Families. Kara Oakley, Tricare for Kids. And Dr. Terry Adiram, Acting Assistant Secretary of Defense for Health Affairs. Welcome to all of you. And I guess we'll just get started. I'd like to address the first question to Dr. Elmore. And as you think about the tumultuousness of the last year and what we've just heard so much about and so richly about the particular burdens that the disruptions in routines and in schooling and other kinds of safety concerns for military kids and their families have put on children, I'm wondering if you could speak to how you see this having an impact on their mental health. And then as a continuation of that, also speak to what military parents and families can do to support their kids, knowing that they already are experiencing a number of transitions, even outside of the pandemic. And Dr. Elmore?
Hi, thank you. So what we can see from the survey is that in 2019, before the pandemic, 63% of kids were going to school in person and only 15% were doing online and virtual. And in 2020, with our active duty families, we switched to 51% online virtual and 28% in person, which probably has increased since the survey was done. And one of the most striking characteristics of the pandemic was the unknown factor. So we didn't know how long it was going to last, how it would spread, what this would look like. And at first we thought it was temporary. Anxiety in itself is the fear of the unknown. So just being in a pandemic and not knowing what your next steps are, what learning will look like, already causes anxiety. Many kids and their parents have not yet developed coping resources to handle so much change and transition at once. Children lost their friends, they lost in-person learning, individual instruction, free time, and had to develop all these new skills with navigating school portals, knowing even what assignments are due. Children as young as in kindergarten are having to kind of figure that stuff out. And what I've heard from a lot of the families I work with, that Walter Reed National Military Medical Center in the primary care department is that the strategies that worked in the past when kids and families were stressed just didn't work anymore and didn't fit their needs. Also, parents are often working from home. They may be having new babies, a parent gets deployed, and they're also responsible for teaching their child and making sure they're getting everything they need while they're in the middle of meetings. And so parents have kind of gotten burnt out. And what I've heard from a lot of families is that they just kind of take everything day by day. There's no real routine or schedule, and things have gotten more stressful with that. And so I actually observed in the pandemic some patterns with my referrals. So in March of last year, when the pandemic first started, many of the referrals I got were mild anxiety, problem solving with families and helping them come up with new routines, some sleeplessness, but pretty mild symptoms. And there was kind of an air of hopefulness about this ending soon and just being kind of a temporary situation. And as the pandemic has continued, especially when it became winter and kids couldn't go outside as much and it was dark earlier, I've really gotten a lot more referrals with hopelessness, depression, lack of motivation. That's a huge one I've seen across all ages. It's just not wanting to do schoolwork anymore, kind of like the kid in the family in the video talked about. Just general irritability and sleep disruptions, a lot of sleep disruptions with the increased screen time and then having different schedule changes day by day. And also an increase in passive suicidal ideation. Now, typically families who have not had to hear their young child talking about not wanting to be alive anymore are alarmed. But often when I talk to these kids, it's not really that they want to die, it's that they don't want to feel how they're feeling anymore and they don't know what to do to make it better. Another big thing that we've seen with the mental health and virtual learning in the pandemic is a good portion of the kids that I see have learning differences or ADHD and have individualized education plans or formal school accommodations. Schools weren't prepared to know how to implement these accommodations at home. So for a kid who can't focus or pay attention, to sit on a computer screen and just stare at a teacher for 6 hours is impossible. To get work done, to get motivated to find out what work you have to do, to even log into the school setting has been hard. We've also seen an increase in parents thinking that their child has ADHD because the concentration has been so bad. And that's been kind of hard to parcel out. Is this just them adjusting to virtual learning, or does this child have more of an organic disorder? Something that's not often talked about, that when we talk about child mental health, that I've seen a lot in my practice is infant mental health. So a lot of the infants may have been born during the pandemic or right after the pandemic, and I've seen some delayed developmental milestones because they're not getting as much interaction with other kids. Parents are busy and they haven't been able to go to daycare. Also, some regression in skills like toilet training or reading and speech and things like that. And like the mom talked about in the video, not being able to get access to those resources. And then finally, especially for military families, we've had a lot of kids PCS to the area during the pandemic. So a lot of our kids are used to doing this, but not in a pandemic. They don't have the opportunity to meet anyone from their school. They're on this Zoom in a new county, in a new area, and don't know anyone on the Zoom call. They don't have opportunities to meet new people, and the parents don't really have the lay of the land of the school. But also we've seen some delays in deployments or receiving orders, which can also make it difficult when you don't have both parents there or you don't know when you're going to move. So those are all the stressors, but we have seen a lot of protective factors, and I think things that really speak to the unique real resilience in military families. So one thing is that military families are already probably better equipped to deal with change and transition and the unknown than civilian families because they're moving so often and they're having to start over and get immersed in the culture so often. So a lot of our kids have had several moves and had to kind of experience not knowing the lay of the land before they started, which I think is a unique strength that being in a military family provides. And also parents are used to kind of being flexible and adapting to things as they happen, which is again unique to military families. But I've kind of separated the things that I've noticed that have been the most helpful to help kids and families with their mental health during the pandemic into 4 areas. The primary one is routine. That is the biggest disruption that I've seen with the pandemic. And then also the thing that helps kids to feel the most safe and have the best outcomes. When everything in the world is unknown, having a routine that's predictable and consistent can be a real safe space for kids. So I help parents to kind of develop routines, have breakfast, have time for school, have a recreation time. Also, it allows parents to kind of plan their work meetings around some of this stuff. But doing that instead of just kind of rolling into the Zoom meeting or school as soon as you wake up without really any motivation or routine. And I've been tremendously impressed with the amazing job these families have done where things change from semester to semester. So having a consistent routine is, I think, the most important thing for all ages. And then the other part I would say is having flexibility and acceptance. This is a pandemic. We're all stressed. We don't know what's going on. Families need to be okay with things not going perfectly. Your child might get more screen time than you want them to get. They may not get as much recreation or eat more snacks. That's okay. We're just trying to survive. So you kind of have to let go of the old ideas of what success looked like pre-pandemic and be okay with what's happening during the pandemic. Like was already talked about, seeking help. So the families that see me are referred by their pediatrician. So they're already seeking help because they made an appointment with me. But there's a lot of families who don't even know that I exist because I'm no longer in the office. And so they don't have access to me. And then also there's so many resources out there that it can be overwhelming to navigate what's in good resources. What should I actually look at? And so it's our job as military personnel that work with military families to make those resources available. Therapy is easier to access than ever because of telehealth. And then I also recommend creating a network of supportive family and friends that may not live in your area to just kind of vent and share tips and tricks. And then the last thing I would say is kids usually depend on their peers to share their emotions and their feelings, especially as they get older. And they may not be used to sharing feelings about stresses of schoolwork or sadness or losing in a video game with their parents. But now they don't have as much access to peers, and their parents are the ones there. And so I usually recommend something I like to call feelings dump. And so it's once a month or once every 2 weeks where families get together and just dump out their feelings and share what's going on. And I recommend that the parents initiate this so that kids feel safe to do it. Oftentimes the kids aren't sure what's going on and they may not share, but having that scheduled and routine, kids know when they want to talk about something, that time's available and it's not going to be awkward to bring up and that their families want to hear it.
Thank you so much. I really love that. You gave so many great concrete examples of how military parents can support their kids, and also thinking developmentally all the way from infancy to adolescence. I want to turn to Dr. Adiram and to think a little bit about what the military health system is doing right now to help military families and kids cope with the burdens or the challenges that we've seen the pandemic place on top of typical military life transitions. I wonder if you could speak to the ways that the system is kind of proactively helping kids cope and also helping to reach children who may be developing mental health issues that need to be addressed.
Sure. Thank you, Dr. Lester, and thank you to Blue Star Families for inviting me to join this event on this very important topic, particularly the mental health of children during COVID. And I'm honored to be here with my fellow guests, some of whom I've known in my first round here at the Department of Defense. Just want everybody to know I'm a pediatrician specializing in pediatric emergency medicine. So as a pediatrician, this topic really is important to me and has been a big concern over the last year for myself and my pediatric colleagues. And as I mentioned, this isn't my first position here at the Department of Defense. I came back in January, but I'd been here before. So I'm very familiar with the stresses on military families with regard to deployments, frequent moves, often in the middle of a school year with a constant changing of friends and uncertainty. And we know that with the pandemic, that as my colleague, Dr. Elmore mentioned, that there's just a lot more unpredictability and lack of the feeling of stability among our families and our children that's been exacerbated by the pandemic. I do have to make a point here. Everybody's talking about virtual schooling and how hard that is. The one piece of good news for our children who are in military installations is that 95% of our Department of Defense educational activity, or DoDEA schools, are open for in-person education, and our child care centers are all open. And this, as a pediatrician, just warms my heart. I think it is really fantastic. It's so good that our children who live on installations will have other adults with eyes on them, and more importantly, will give them the opportunity to grow and develop as they should through their peer interactions. So you asked specifically, what is the military health system doing? Well, we've done a number of things. And as my colleagues have already mentioned, we've expanded behavioral telehealth options, and we've opened that up not only within our direct care system, but also through the civilian, or what we call the purchase care, Tricare sector. But one thing that people should note, I know we have a great resource at Walter Reed with Therapy for Children. Most of our mental health services, 92% for our children, are provided through the purchase care system or through Tricare. So we really rely on the civilian sector. And as you all are aware, many of you are aware, the civilian sector has significant challenges with access to child mental health services. And this is exacerbated, not just the challenge of having enough child mental health providers, but also providers that take Tricare, let alone any insurance. Most of them, or many of them, take cash only. So that's a huge challenge for us that we're continuously working on and continuously pushing our Tricare program to do what we can to increase that access. What am I working on specifically? Well, one of my first meetings that I had was with our Military Community and Family Policy Office. I had, in my first time here, worked on a program called Healthy Steps that we had started piloting. It's now in 5 MTFs, and this is a evidence-based program that's within pediatric practices that uses people that especially trained for this program, that identifies children of the youngest children for families and coordinates needed services. And what I'm discussing now with my colleagues over in the Military Community Family Policy Office is how can we expand this program for families of older children? And I think this is really important because, as we heard in one of the videos, the mom who said that she just didn't know where to access services, this could be one of the solutions within the pediatric medical home to help our families identify where they can get these services. So I'm just very proud that I got to help start this program my first time here, and I'm so pleased to see that it's being expanded now. So as Mrs. Milley also said, families have access to Military One Source. And especially as Dr. Elmore was talking about, that there's some children who may have what may be considered more mild symptoms, a little bit of anxiety, a little bit of sadness, not serious mental health problems. There are non-medical counseling services that can be provided through Military One Source. So families should access that as much as they need to. The other point that I want to make is that the military health system has really embraced the patient-centered medical home. And that's a really important concept where services are coordinated on behalf of the patient. They look at the child or the patient holistically, and the primary care manager is responsible for ensuring that that child or family member is taken care of and has the services that they need. And some of these include things like Military Kids Connect. It's an online community specifically for military children age 6 to 17 that provides access to age-appropriate resources for military kids and also for parents and their caregivers and educators to help them understand and support military children and their issues. We also have a school behavioral health program that's part of the child and family behavioral health system. And this is really great because it embeds providers into the on-post schools. We have this particular resource at 17 of our installations, and they provide direct behavioral health clinical care to military children and adolescents. And so with that, I'll turn it back over to you. But those are just some of the programs and some of the ways that we're trying to increase and improve access for our military children.
Thank you so much, Dr. Adiram. It's really, really great to hear how the ways in which you're reaching families where they are, reaching kids where they are in schools, in primary care. I think that that is definitely making mental health care more accessible to families and kids. I'm going to turn to Kara Oakley at this time and really ask you to think about this issue of access. Almost half the families did not endorse having access to high quality health care, mental health care for their kids. And I wondered if you could talk about some of the solutions that can increase accessibility and continuity of behavioral health care for military connected children.
Yes, thank you so much, Dr. Lester, and thank you to Kathy and Blue Star Families for making this a topic of today's conference. I'm Kara Oakley. I am an attorney. I come at this a little bit different than the experts you've just heard from. I come from the policy and advocacy side. I've been working on behalf of children's hospitals for 20-ish plus years on military children and their families' issues around the health and well-being of military kids. So what I'm pleased to lead the Tricare for Kids Coalition, and we have also been putting a lot of thought into these kind of questions, and we're thrilled that Blue Star Families was able to ask these questions of military families so that we see their concerns and we hear about things in sort of as much real time as possible. And we know that there's an issue with access to mental health care for kids. And as Dr. Adiram and I think Dr. Elmore alluded to, there's already shortages in pediatric practitioners and practices and opportunities out there. So in a way, what we just want to do is ask and look to Tricare to get out of its own way for families. Don't create barriers. It's a process and a system with a lot of complexities and some built-in barriers and redundancies. Not unexpected to anyone on this call to hear that, I don't think. But what we need to do is work on getting through those barriers, opening up access, making things easier for folks to navigate to get this kind of care. When we talk about what's needed in the mental, emotional, and behavioral healthcare space, for kids, we look at prevention, early intervention, community supports, crisis care. And then one of the things that we really see as an issue is the better understanding and navigation of accessing higher acuity care. So given you a few concrete examples of things we have seen. We love to build on successes. So like Dr. Adirm talks about healthy steps. We think that's one of the great projects that could be done. And if we can build on something like that to help families navigate. Along those lines, there's a program that is getting rave reviews called the Tricare Select Navigator program. We know of a partnership, and you in the breakout session may hear a little bit more about this. We know where they're working with some mental health providers to provide their navigation services to the kids that meet. It's a pilot project right now to help families negotiate sort of some of the most complexities of the system for kids who interact with it in so many different ways. So we're looking to, for possibilities to expand that and to really utilize it with respect to behavioral, emotional, and mental health services. Again, another way of building on a best practice. And so one of the things that we noted, and it was in a report that came out, I think in August, was how much trouble, and there was an article that came out about it too last year. So we're seeing this in a couple of different ways. In addition to the data presented today, that families have a hard time navigating getting appointments and referrals and then getting to the right providers. So we'd like to see a scheduling pilot, and then that could possibly be supplemented by something like the Healthy Steps or the Select Navigator to really run through the system. But a scheduling pilot, because you do not, finding the right behavioral health provider for your kid is not as easy as just finding a pediatrician's office or a different type of specialist. And if you're looking at higher acuity care and institutional kind of providers, we're actually looking to see if Tricare would require national in scope provider directories, because that's not something a family can plug in their zip code and get an institutional care provider that meets their needs, takes Tricare as meets their age group of their kids for their admittance requirements and things like that. These are already kind of difficult things to come by, and it's not something you can put in. So we're looking at more specific and accurate provider directories requirements, and for institutional providers, particularly looking at let's look at the entire scope. And we don't like this necessarily, but a lot of times the families are going to have to go 2 or 3 states away even for care if it's that kind of higher acuity care. But what we can really do is help them find it. So then I'll go backwards for just a second back to what we want to look at as prevention and early intervention. So we really want to take advantage of all the screening opportunities. Again, you've heard about some of those. A couple of years ago, I think Tricare aligned itself with Bright Futures, which are the AAP guidelines for well child visits for kids. Mm-hmm. And we really would like to take a real deep look at that and let's look and see if those are being implemented and those screenings are being done. And are there additional screenings that can really look to specific mental, emotional, behavioral health needs like eating disorders and some of the other things we're starting to see in our children's hospitals and pediatric practices more and more now. Are there other screenings that we do need to implement? So that's sort of our laundry list, if you will, of ideas for the entire spectrum that we'd like to see families supported upon. We want them to get access to that high quality care, and we know it's out there, but it's not always easy to navigate.
Thank you so much, Kara. And thank you to our panelists. To say this is a complex issue, building an entire continuum of behavioral health support for military children, from all the way from screening and prevention to treatment, and having it be highly accessible. And I feel like we've just scratched the surface, but it's been really, really a thoughtful set of discussions. And I know the deep dive to come will be an opportunity to look at the data kind of in more detail. But I was so glad to be able to have this conversation with you here today. And I'm going to pass it back to Kathy at this point.
Dr. Lester, and thanks for all of, thanks, Dr. Lester, and thanks for all of our panelists. What an amazing discussion. And I also feel like we could go on with these experts, and perhaps we'll bring you together again in another opportunity, because I think there's so much richness there. It's now my honor to welcome Senator Blumenthal to say a few words. A member of the Senate Armed Services Committee, Senator Blumenthal has championed legislation to protect the health and well-being of our military children. He is a Blue Star family himself. He has a child who served in the military. He's been a true friend. Thank you for joining us to say a few words, Senator.
I'm Richard Blumenthal, United States Senator for Connecticut. Very, very proud to be part of this event, seeking to explore the ways that we need to provide more care for military children. The challenges faced by military families have preoccupied, rightly, Blue Star families, and I am so grateful for all of your service to the men and women who serve and their children and loved ones. I know firsthand how important your service is because my wife and I were Blue Star families while our two sons served, one in the Marine Corps as a combat infantry officer in Afghanistan, and the other a Navy SEAL deployed around the world. What Blue Star families do ordinarily is so much more important now because the challenges have increased. And those challenges particularly affect children in military families. Even in ordinary times, the frequent moves, the changes in schools, the absence of a parent made for tough times, indeed sometimes trauma. But now in the pandemic, the dangers of mental health challenges are even higher. Not only are there potentially longer deployments, but also potentially less employment and other kinds of changed circumstance. And so access to mental health care and removing the stigma that may accompany it are more important than ever. I'm committed to work hard to provide more resources, as I have proposed in legislation during previous Congresses. I'm going to offer it again. Ending any discrimination, because people should have no reluctance about seeking care when they need it. And I thank you, our military families' advocates, for tirelessly pursuing and protecting their welfare. Your work is so important to our nation, our readiness, our resilience, our retention of skilled, dedicated men and women, and their children who very often follow in their parents' footsteps because military service, more than ever, has become a family tradition in America. I thank you for your patriotism, your hard work, your resilience, readiness, and your unshakable dedication to men and women in uniform. Thank you.
Thank you, Senator Blumenthal. Thank you to all of you for coming along with us on the journey of the last 2 days. Thank you to our members of Congress, our senators, our government officials, our nonprofit leaders, military families, corporations and foundations. All of us together support and need to support the men and women who serve, their families, and our veterans and the veterans who serve. And the veterans' families. We are delighted that you were able to have access to the survey and its findings as never before. We hope you'll continue this conversation with us online. Make your comments and use the hashtag BSF survey and join us for the breakout session immediately following this panel discussion to learn even more about these results. Before I turn things over for the last time to our fantastic board member, CNN anchor, Brianna Keeler, I'd also like to take a moment to recognize once more our sponsors, because without them, this important work could not be done. Thank you for supporting military families and the military-connected community. Finally, please take a moment to fill out the post-event survey. Your feedback helps us do better. And now, Brianna, I turn it over to you. Thank you, everyone.
Hello, I'm Brianna Keeler, CNN anchor and author of the column Homefront, and I am also honored to be a Blue Star Family's board member. As a military spouse and as a mother, I understand the stress that comes with unpredictability and continual uncertainties that are a part of the military lifestyle, and also the toll that it takes on our children. Blue Star Families is putting in the work to better understand our military families' top concerns, like understanding the mental health of our military kids through the annual Military Family Lifestyle Survey. This is important work, and it is affecting policy and influencing decisions made at the top levels of the military. After looking at this issue over the past hour, I invite you to join Rob McCartney, CEO at the Barry Robinson Center, and speak with our research team directly in a data deep dive breakout session. We're also fortunate to be joined by Mrs. Shireen Brown, who will share a bit about her personal experience as a military spouse to begin this discussion. During this next hour, the Blue Star Family's applied research team will be at your fingertips like never before. So dig into this data with the people who know it best, where you will be able to ask your questions. To join our breakout session, just click on the link in the chat to the right or at the bottom of this page. Thank you for joining us today. Your participation is helping Blue Star families move the needle and generate progress within the military community.